First, let me begin by thanking each of you, delivering hospitals across Arkansas, for being here. Whether you're joining us from the Delta, the Ozarks, or Central Arkansas, your presence in this room signals your commitment to healthier mothers, healthier babies, and a stronger Arkansas. This roundtable was created with one goal in mind: to align, connect, and empower the clinical and administrative leaders driving maternal health across our state. It's a space for honest dialogue, policy understanding, service innovation, and shared accountability. I want to extend my sincere gratitude to our partners in the Arkansas Hospital Association for co-hosting today's event and taking my phone call several months ago to do this. Their leadership and collaboration were instrumental in making today possible. I'd also like to thank all of our speakers, panelists, and moderators who will be sharing their expertise and insights throughout the day. From legislative advocacy and policy updates to reimbursement strategies and innovations in care, every presentation and conversation is designed with one purpose: helping each other improve outcomes for the women and families we serve. This work is urgent. Arkansas continues to face some of the most challenging maternal and infant health statistics in the country. But today we have an opportunity to start rewriting that story. As we begin this session, I want to thank you all for the incredible work you're doing in each of your hospitals to serve Arkansas mothers and infants. Today I'm going to share how the Arkansas Center for Women's and Infant Health is working to improve maternal and health outcomes, and how your hospital or clinic can be a key partner in this effort. The take home will be that in order to improve health outcomes for moms and families, we all need to work together and be key partners. So the idea behind this really started as a seed several years ago. And with this, we developed this center. And the idea is that we can help collaborate with each of your hospitals. And again, I think the take home is that we would like to be partners, and we want to show how we can do that better. First, let's frame the issue by discussing maternal mortality in Arkansas and the significance of the postpartum period. And for most of y'all, this is not new. Then we'll talk about the center and what we're doing to address some of these issues. We'll discuss what's next and where we're going from here, and then we'll talk a little bit more about how you can help us implement these initiatives across the state. So, as many of you know, most of the maternal deaths in Arkansas happen in the postpartum period. This was a little surprising to me. This happens weeks, even months after giving birth, when way too many women slip through the cracks. The Maternal Mortality Review Committee found that over 90% of maternal deaths in our state were preventable, which is why we created this center. And again, I want to go back to this preventability, because I think as a provider and as hospitals around the state, we see that number and it's so daunting. But when you think about preventability, we think about missed opportunities, right? We think about access that couldn't have happened. We think about opioid abuse. We think about a lot of things in Maternal Mortality Review Committee that we may have been able to touch one patient differently and change the outcome. And that is why this number, again, is much more feasible to fix than we think. Nationally, the United States has a maternal mortality rate that's higher than many of the other developed nations, but Arkansas' situation is especially dire. We consistently rank among the worst in the nation for maternal health. The statistic isn't just a number. It represents lost lives, families impacted, and communities left to grapple with preventable strategies. There are several contributing factors that we need to address. First, let's talk about the rural access. Arkansas is a largely rural state, and for many of our communities, that's considered healthcare deserts, meaning they lack access to essential medical services, including maternal and prenatal care. For women in these areas, getting the care they need during labor, pregnancy, and the postpartum period can be extremely difficult. Another is social determinants of health. Things like income, education, transportation, and housing also play a huge role in the maternal health care crisis. These factors affect not only access to health care, but also a woman's ability to stay healthy during and after pregnancy. These challenges disproportionately affect women of color and those in underserved areas, compounding this problem even further. While people think of maternal mortality as something that happens during labor or delivery, the reality is that more than half of these maternal deaths occur after birth. This leaves a critical point because it means that women are often falling through the cracks after they leave our hospitals. And Black mothers are dying at 2 times the rate of white mothers. In the postpartum period, women are at risk for a range of serious complications, many of which can be missed or overlooked as normal if you're not looking for them. Some of the most common causes of postpartum maternal mortality are hemorrhage, hypertensive disorders like preeclampsia, infections, blood clots, cardiac conditions, and mental health crises. Each of these complications is preventable or treatable with the right care. But too often, women are not getting the follow-up they need to catch these issues or fail to see the signs and seek help. Why, right? Why is this happening? Well, missed maternal warning signs. Several of the symptoms of serious complications can be very subtle and easily mistaken for normal pregnancy postpartum. Lack of follow-up. Over 40% of women don't attend their postpartum visit, which is crucial for identifying and addressing potential healthcare issues. And then we have barriers to seeking help. New moms may dismiss symptoms. Often they're just part of the recovery process, is what they're told. Others struggle trying to find childcare, navigating transportation, or simply prioritizing their own health while taking care of a newborn baby. And the disconnect in emergency care. Even when women do seek care, emergency providers may not immediately recognize some postpartum specific risks, leading to delays and misdiagnoses. These barriers highlight the urgent need for a system of care to support during this postpartum period that's essential. But we think there's solutions. The Arkansas Center of Women's and Infants Health was established with a clear mission: to tackle the maternal health care crisis in Arkansas head on by providing innovative solutions, improving access to care, and supporting women in the postpartum period after childbirth. Our center was born with one fact in mind: Arkansas has one of the highest maternal and infant mortality rates in our nation. We're here to change that. We partnered with healthcare providers, public health agencies, and community organizations to improve health outcomes for women and infants across the state. Our work on this center addresses issues affecting pregnancy, postpartum, and infancy to ensure that Arkansans have the resources they need for healthy pregnancies, safe births, and thriving infants. So who do we serve? We serve the whole spectrum, or we hope to, from maternal and infant health, supporting women directly, equipping providers with tools and training, and engaging the broader public through education and outreach. So we have 4 key initiatives to better support, and these are kind of what we'll talk about here in the next few minutes. Postpartum education, the mother and infant supply kit, those kind of we bundle into one, the I Gave Birth bracelet, and the proactive postpartum call center. So I'll kind of break those down. Postpartum education. So we started with the idea that we wanted, no matter where you delivered in our state, what corner, what area, what type of provider was delivering you, you walked away from the labor and delivery experience with the same education as everybody else. So there was no gaps in education with regards to that. And I think that's important in a lot of ways. You know, we know there's areas of expertise in certain areas, but that shouldn't be affected by the patient and the end outcome. So we standardized that. We got our national organizations and we got leaders in pediatrics as well as obstetrics and gynecology to kind of streamline the education so that every mom and family that leaves their labor and delivery will hopefully get the same early maternal warning signs and things to watch out for, as well as infant safety information. That way we're all on the same playing field from the very beginning. Next, we wanted to ease that transition into home hopefully kind of building trust within the healthcare system and giving some of the essential things that moms and new families may need to hopefully prevent people from having to go immediately to a store and buy some of these essential things. And if you go up and look, we can kind of see one of our sample infant supply kits. There's diapers and wipes and vitamin D and breast pads and all the things that really a new mom and family can benefit from immediately in that postpartum period. We hope that this will divert time going to spend on gathering these items to spending time with the family and really concentrating on that part of this. And we will talk a little bit more about how we hope to bring this to the hospitals. We have some partners with regards to this that will be working to make these supply kits and hopefully sending it out to you, all of you that are interested. So we have launched all of these at UAMS thus far, and this pilot launched in March of 2025 and has been a huge hit. So what's in the kit? Like I said, I mean, everything from nursing pads to diapers, vitamin D drops, a thermometer, just crucial items that we thought would be very beneficial. And again, over time, if we see that there's certain things that people need more than others, then we can pivot and change. So this is kind of the second tier, and it's not a new idea. There's been hospitals around the nation that have done this, and there's hospitals in our state that are starting it. It's a simple and powerful way to support postpartum health. It's a bracelet. It's called the I Gave Birth Bracelet Initiative. It provides postpartum patients with a bracelet after delivery. So it's a visual sign that I gave birth. It's a visual sign to patients. It's a visual sign to families. It's a visual sign to other healthcare providers that this patient may present with new and different things, and it's not to be overlooked. It's bright blue, so it stands out, and we wanted this to signify for the families and for the providers around it. So again, you know, I always, an example I give is in the postpartum period, you know, a blood pressure of 140/90 is not something that most ER doctors would care anything about if a patient shows up with that. But if you're postpartum, I care. I care a lot about it. And so it's a visual provider for not only the patient to take their health seriously, but other healthcare providers to recognize that that patient may come with different symptoms. An interesting thing on these is there's a QR code on that bracelet. That QR code will lead to our website, myarkansasbirth.org. And on that website, there is a wealth of information. There's videos, there's education. So if that patient is, you know, 2 in the morning and is trying to figure out how to work lactation services and get resources, they can scan that code and it's readily available. If that family member is like, oh my goodness, she's not acting the same and I'm worried about X, Y, and Z, they can scan that QR code and also get valuable resources. So it's an easy stop, and we hope to continue to build onto that website as well. And lastly, one of the things I'm most excited about is the Proactive Postpartum Call Center. It's designed to improve maternal health outcomes by ensuring postpartum women receive timely support and care coordination. The Proactive Postpartum Call Center provides direct follow-up to women in the days after delivery. Nurses will go through a medical and kind of social determinant health questionnaire. So we've kind of predetermined all of these questions that our nurses, our fabulous nurses in this call center go through. And what the idea behind this is A, if you screen positive for a healthcare questionnaire, then you will be asked to you know, follow up care in whatever clinic or area that you were in. If there are social determinants of health, say you need diapers, say you need formula, we will have community healthcare workers that will help reach out and get the resources that we already have developed in our state. And I think one of the more telling things that I hope that we will gather from this is, what do we not have in our state? What do we have in the Delta but we don't have in Central Arkansas? Or what do we have in certain areas and not in others? And then we can go later to our legislative friends and ask in the next session that here we are with data to support, here's what patients needed, here's where they had it, and here's where they didn't. So I think this is a wonderful opportunity for us to kind of partner, see what we have as far as resources, see what patients can use, and also what we still need. Another big part of this is asking about insurance coverage. We will ask them if they have Medicaid, and if they need help with the reapplication process, we then team them up with workers, community healthcare workers that will help in that process. So we hope to see a lot of improvement with regards to this. So our impact to date, and again, we have been a small but very mighty group that have worked on this, but I think the impact is incredible. Almost 900 I Gave Birth bracelets have been distributed. Of our first calls, 70% of patients have responded to these calls, and that's the part I really didn't have a good concept of. When we developed this, we're like, will people answer these phone calls? I don't know, because I don't answer phone calls. I do not know. So, but it just goes to show they are eager to get help. They are eager to kind of tell what's going on with them, and they are trusting of us in calling them. So I'm super thankful for that. But you can also see 30% of patients reported an urgent maternal warning sign that we then sent them to their local community, either ER or labor and deliveries. And 48% of patients had some social determinant of health issue that we were able to help with. So the future. Our future vision goes beyond this launch. It's not just about the initiatives we started, but it's about what comes next and how we build lasting impact together. Looking ahead, we're going to partner with the Perinatal Equality Collaborative on the next bundle to support quality improvements in postpartum care. Work with our vendor to coordinate the distribution of these infant supply kits easily to the hospitals that want them, and the I Gave Birth bracelets to hospitals across the state. And we hope to scale up our call center with the goal of calling every postpartum patient in Arkansas by the end of the year. We want all of you to partner with us as we expand these initiatives, and we'll talk more about how you can connect with us in just a bit. Infrastructure. Our infrastructure supports hospitals, large and small, metro and rural, to deliver consistent postpartum care. We're standardizing discharge education and integrating support systems statewide. And this is our website. This is our hub, where patients and providers alike can find consistent, clear information. We encourage you to share this with your staff and patients. If you have ideas on what would be helpful on this website, please reach out. We want this to be something for all of us. We want this to be a resource that patients use, that families use. As you can see, visitors can access the site. There's comprehensive tools for maternal health. It's before, during, and after pregnancy. But we need your help. So this is a QR code that's a little different. So on your tables, I probably should have told you, if there are questions that arise during any of these presentations, please scan the QR code on your table, and those will get vetted and be asked throughout these presentations so that we can answer all of your questions throughout this incredible convening. But with this as an interest form, and we'll have some paper copies as well, when we empower families to transform outcomes, we will do better as a state. With your partnership, we're creating the kind of healthcare system Arkansas families deserve. If you haven't already, please fill this out. It's also in your folders, and we'd love to hear any ideas or changes or anything that we can help add to this that will continue this conversation. So with that, I will leave it to any questions, if there are any. And again, I just want to thank you all so much for coming. Having all 30, when we first thought about this, we were like, oh gosh, okay, so we've piloted everything at UAMS. How do we get the information out to all of our delivering hospitals? Do we set up one-on-one meetings? Do we, cold call? And again, the idea started, and Jody Ann, which I'm so mad she's not here, introduced us to Lindsay, and we came up with this idea, and I'm so thankful for that, because I think the delivering hospitals, the administration, the people with boots on the ground meeting at a regular interval, and we can decide what that is, I think could be so impactful to changing the momentum and changing the trajectory of maternal health in our state. We have so many good people working on this. I mean, I look around this room and it's not just delivering hospitals, it's just advocates for maternal health all over. And so many of these pieces are already moving in that direction, and I'm so thankful, but looking at this makes me so hopeful for where our numbers will look in the next few years. So thank you all. Okay, well, I had just a couple of questions that came through that I wanted to make sure to address before I let everybody go. There are approximately 36,000 births per year in Arkansas. To make the rough 3,000 postpartum proactive calls per month, is that envisioned to be exclusively through the Arkansas Center for Women's and Infants Health, or outsourced, decentralized to maternity hospitals and based on guidelines protocols? And what can the hospitals do? So currently the plan is for us to implement those. But I think we need partners, and I know we would love to team up. And if there is a system that works better for your hospital, then we want to address it. I know that one size does not fit all with any of this. And so we have the funds to start this process. We have the funds and the resources and all of the questionnaires, and we are happy to share that. We are happy to do that. We are happy to create ways that those patients can better serve your communities. And I think the take home from this is that we want to be implementation partners. That shouldn't be a hard word, but we want to be partners with you. And we know that what happens in one hospital that may be a big hospital and a small rural hospital may look very different. And we want to sit on the playing field and kind of talk with that. This meeting and this conveying, which I'm so thankful you guys are all here, was an opportunity to get all of us at the same place to talk about this. And so I want to make sure that this conversation continues. What we talked about today continues. The new things that come about continue. And so we would really like to be implementation partners. Another question, does the bracelet QR code cover safe sleep education and car seat safety? And if it does. And so please look onto that website. If it's not on there yet, it will be soon. But we are committed to building out that website to better serve what we need. Anna was talking about the Pregnancy Plus app. There is a direct link to our website on there. We will directly link back. We want these resources in our state to work together and create synergies. That's the whole point of all of this. And then the last question I got, are the call center calls recorded? Is there any disclaimer that mothers' honest answers will not be used against them? As someone suffering from postpartum depression, I would have never answered these questions honestly in fear. So there should be no fear of retaliation. This is not meant to be punitive. These are not recorded. These are honest answers. And the whole point of it is to just get resources back to those patients that are in our state. And like Dr. Jones mentioned, we have resources. We have a lot of resources. And it's just hooking up those resources with the right patients and right communities and figuring out how to do that, I think, is the challenge. And again, I think, we talked about this statewide process. I think, Krista texted me just during this presentation, and she said if we had one partner from every delivering hospital to start the discussion on what a statewide network would look like, we would be 10 steps ahead by the time we got that. And so I really implore you guys to please reach out to me. We want to be partners in this. We recognize that one step does not fit all, but I think this is the first part of this conversation. So this brings us to the end. Again, I thank you all so much for coming. I think a few themes that have come about is that hospital collaboration is essential. And by you guys all being here, I think that proves that to be true. Second, that policy and practice must work hand in hand. And I think we also see that by the fact that we have so many legislative representatives, by the fact that they are vested in what's happening in maternal health in our state, and then we have the hospitals here to implement these changes in real time, I think speaks wonders to that. And third, that we are at a moment of tremendous momentum. We, you know, me and Sam Greenfield sometimes talk, like right now, maternal health is a shiny object. I live in this world. I will always have this be a shiny object, but I need real change to happen while it's still the shiny object that we're all chasing. And so I think we have a lot of opportunity for that momentum to happen right now, and I just want to thank you guys for being partners in that. So moving forward, we would like to do this at some sort of regularity, recognizing that we're all busy, and please give us feedback. I mean, we want feedback on what has been helpful, what has been not. I think what we wanted to do with this is, you know, a lot of us live in this world, but many people live in their own siloed worlds and don't recognize that healthy moms, healthy babies, or care models, or so many of these changes that I eat, live, and breathe in the legislature are happening. And so I think this is an opportunity for us all to say, okay, what changed and what does that actually mean for my rural hospital? What does that mean for my urban hospital? What do those reimbursement changes, what's the bottom line of that? And that's where I want this to be a conveying where we can talk about those real issues in an honest and transparent way. And if there's themes that come about that you're like, I really wish we talked about this, then please send that to me because I'd like that to be on our next agenda items. Lastly, I want to thank our panelists, presenters, moderators, guests, everyone creating this great conversation around this. It truly has been so wonderful to see this all come to fruition. But most of all, I want to thank the people that helped us put this on. Krista and our team with the Arkansas Center for Women's and Infant Health, they are a small but mighty team. The Arkansas Hospital Association that has been instrumental. Lindsay, thank you for answering the phone call when Jody Ann sucked you into this. The Peacock Group that has been so helpful in organizing everything. And everyone from Kirkpatrick to Nelson to taking pictures, thank you, thank you, thank you. We appreciate you guys being here. We know we are all committed to safer moms, safer babies, and we hope to see that the fruits of our labor will continue for years and years to come. So safe travels, and thanks again.